So talk to me about migraine headaches.
So there's lots of different approaches out there that people search for migraines. It's this awful syndrome that really is debilitating. The approach that we take, which is very different, is trying to understand why the pain is there and where it's coming from. You know, you would think that if someone has severe headaches, it's really an issue with the head, and it might be. But equally, and sometimes even more often, it actually has more to do with the low back, which is kind of an interesting scenario. So I give you an analogy or sort of an example. Imagine someone that's in a car accident and they get front-ended or they rear-end somebody else. There's been a lot of research studies over the years done by a lot of the car companies, like Volvo, for example, where they found that when a person is front-ended, even if they don't actually hit their head on the windshield, there is an enormous amount of force that goes into the body through the head. And that head actually travels down the spine. And I'll show you as an example. So you've got this spine here, right? And so what happens is the force goes into the head, and that force travels down the spine, and it comes down to this bone at the bottom of the spine called the sacrum. And it actually shoves the sacrum downwards. Not necessarily a huge amount, it could just be a millimeter or two, but it creates a syndrome that's called a descended sacrum. It's actually very common. Think about how many of us have hit our head or had some kind of a motor vehicle accident. Well, the challenge with that is the spinal cord, which of course up here is connected to the brain and the brainstem, actually adheres onto the sacrum. It has an attachment to the sacrum. And so when the sacrum is pulled down, you actually get this tug-of-war, this complete tension where the spinal cord is being pulled in opposite directions. And it can contribute to an intense amount of upper back stiffness and tension in the neck and migraine headaches. Very, very common. And so in our approach, what we would do is mobilize the spine in a very gentle way. It's not adjustments like chiropractic. It's very different from that. And it's trying to create more alignment and more, I should say, a less amount of tension in the spine so that there's less tension at the base of the skull. And that process can create so much pain relief for a person. It's amazing. But also understanding that sometimes this person has been in this situation for so long, it's very chronic, that just mobilizing is too aggressive. And so we need to go in through sort of the back door and use a lot more gentle fascial releases where we're trying to find ways to sort of coax the sacrum into more of a neutral position and take the tension off the spine. It's a very gentle approach, and it's different in the sense that, again, we're looking for patterns that are going to guide the person to a place of not just pain relief, but long-lasting pain relief. That's always a huge goal for us.
That sounds fantastic. Thank you for telling us about that.